Hi, my name is Emily Kosderka, and I'm an assistant professor in the Exercise and Sports Science program at Concordia University. Welcome to this presentation on EBP for ESS, or Evidence-Based Practice for Exercise and Sports Science. The reason we're here is because exercise and sports science professionals are increasingly being asked to provide evidence for the decisions that they make and their practice every day, and rightly so. But what is evidence-based practice? How do we use it to inform the decisions that we make on a daily basis? So our objectives today are, number one, to simply define evidence-based practice. Number two is to construct what is known as a PICO question. This is a clinical question that we need to have answered. And number three, to apply evidence-based practice using a very simple 5-step approach. What is evidence-based practice anyway? This term that we keep hearing over and over again. Sackett in 1996 defined evidence-based practice as the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients. But what does that actually mean? Where does the evidence actually come from? When we think about evidence, we often think about what is probably the simplest place to get it from, which is probably from research. But we get evidence from a lot of other places too. So common responses to this question include things like expert opinion, we also think about position statements from our professional organizations. We consider consensus statements from organizations that get all of the leading experts in that field together. But often we forget about some very important sources of evidence, which are our own clinical experiences, and expertise. And also, definitely not to be forgotten, is what our patient thinks. And that's our patient opinions. And values. So when we look at all of these sources of evidence and we apply that to what is known as evidence-based practice, we can actually think about this in terms of a stool. And the stool has 3 legs. And in evidence-based practice, those 3 legs are made up of the best available research, our own clinical experiences and expertise, and our patient opinions and values. Because each of these matters when we are making decisions for our patients or our clients. So when we think about the stool, here's our evidence, or our EBP, and it's made up of 3 legs. Research, patient opinions and values, and clinical expertise. So we need to remember simply that there are 2 fundamental principles when it comes to evidence-based practice. Number one, the research evidence is never enough. It's not enough to read journal articles and systematic reviews and use that as the sole basis for our decision making. And number two, there is a hierarchy of evidence. There is some evidence that is better than others. So now that we know where all the evidence comes from, how do we actually use it? And this is where we use our very simple 5-step process, or what we refer to as the 5 A's. The first A is probably the most important because this is where we need to ask the question we want answered. And to do that, we put it in the form of a PICO question. P is our population of interest. I is the intervention we're interested in. C is the comparison to maybe another method. And O is the outcome. So take, for example, something like the altitude mask. If we were to write a PICO question to help one of our clients determine whether or not it was worthwhile for them to spend $150 on an altitude mask, we could use a PICO question to help them answer that. Our population of interest may be athletes. So in athletes, does use of an altitude mask compared to aerobic training alone result in increased VO2 max? That would be our outcome. So that's an example of how to use a PICO formula to ask a clinical question. The next A is to acquire the evidence. And often this means searching through the literature to find what has been published on the PICO question. Once we acquire the evidence, we need to appraise it. Do those studies apply to our population? Are they well-conducted studies? What are the threats to validity in those studies? We appraise the literature to make sure that it is applicable to how we want to use it for our particular population of interest. After we've appraised the literature, we're going to apply what we found. So whether we're talking about an altitude mask, or perhaps we're looking at a way to rehabilitate post-operative ACL reconstruction, we're going to apply those things that we have found to our patient or to our client as part of the evidence-based practice approach. And then finally, once we've applied that, we want to make sure that we come back around and assess the results and how it has gone. And that's it. It's a 5-step approach to using an evidence-based practice approach to any field in exercise science. So if we go back to our original objectives, we wanted to define evidence-based practice. We now know what that is. We wanted to be able to effectively construct a PICO question, and we have done that as well. And finally, we wanted to go through the 5-step approach to applying an evidence-based practice regimen to answering our clinical question. And we've certainly done that. And hopefully, this will help all of us as exercise science professionals when we are asked to substantiate the decisions that we're making and the everyday practices that we're doing with evidence. Thank you so much.